Okay, tell us something about yourself and how your journey has been so far as a doctor.
Okay, I'm basically from the commerce faculty, and I was doing pretty well. I was handling World Bank tenders. I was handling work for Sri Lanka government. I was having my offices abroad. So I was basically into business, doing very well with even oil business and all that, having a lot of properties. One fine day while traveling, I met a soul, a great soul, Ma Nirmala Devi, and that was a day that I changed my life. So I had been visiting some relatives' place. The same night I left them, I came home, I picked up a bag, packed my clothes, and I went off on my journey for spiritualism. So from here onwards, I met a lot of spiritual heads from different countries, from different parts of life, and I got hold of about more than 40 therapies I learned. And uh, I knew that my journey was for spiritualism and not to make money. So it started like that. But then I had a lot of challenges in my own life. Uh, I was quite accident prone, and I heard while I was in the hospital, the nurse telling the doctor, okay, let's ampute his legs. And I ran away from the hospital saying I can heal myself. And within a week's time, I was back with them that amputation is no more required. I was again once admitted to Hinduja hospital, whereby the doctors told me that you are paralyzed for life. And they told my parents, take him away. We can't do anything for him. He is totally paralyzed. And this was Asia's #1 doctor who said that. And I challenged him. I said, I will stand up on my own. So you see, with these challenges, which I got as a blessing, it provoked me to work in an industry, the wellness industry, where I found out that if I can save my life and the operations, why not I take up this challenge of helping the masses? So leaving everything behind, I took to this journey of healing. And like I said, I took my training in 40 different therapies with more than 80 awards from India and abroad. So this helped my path in my growth, and well, that's how it all started.
Okay. Okay. So, sir, it seems that you have a total different idea of healing, right? But in younger generation, especially our generation, we have a total different idea of healing. We like if we fall ill, like we rush to a doctor, and this concept of healing ourselves on our own, is very it just does not come into our minds. So how do you as a doctor has been inculcating this idea in the younger generation that yes, it is possible to heal yourself on your own?
Well, basically it's faith and surrender. That's more important. Like for question number 1 that I was asked, I would like to add there that I started my journey in 1988. And this journey I started because while I was doing healing or treatment for cancer patients, uh, I got a few cases. Or my very first case was from Breach Candy Hospital. Yeah, it was a lady who had been told by the doctors that she won't survive and there is no way for her to survive. And I took up her case. And in 3 months' time, the doctors gave a clean chit that she is out of cancer. So that was one major thing. And then after that, I started getting other offers from doctors from Nair Hospital, from Holy Spirit Hospital, from Sion Hospital, and various other hospitals. People who came to know that I can take up terminal cases. So they started recommending cancer cases to me. And in 3 months' time, they were rid of the disease. So then it was a time that I decided, okay, let me stick to cancer and let me work on this problem. Though after that, I was even attached with Government of India's project at Nair at JJ Hospital, where they were treating HIV cases. Where while treating HIV cases, I had the opportunity of treating 3 AIDS cases, and they all were cleared after our treatment. So that gave me the confidence that why not work with terminal cases, because that is what is the call of the day. So, well, I started working with terminal cases since then.
You have 33 years of experience treating cancer patients. So there must be a set of challenges that you must have faced. Can you elaborate on the challenges and how your unique approach helped you to overcome all those challenges?
Yes, I have been working with cancer cases for more than 33 years now. And I took it up as a challenge to work with these cases because at the end of the day, these people don't survive more than 3 years. So there was something that told me that this is not the right thing, that we subject a patient to surgery or medication or these type of treatments. It doesn't work out. So I started doing my own research for cancer, and through various modalities I was finding out how I could help these people. uh, we did a lot of healing work, we did a lot of research on this, but at the end of the day, the question that came in my mind is that whether it's asthma, arthritis, diabetes, cancer, thyroid problem for ladies, at the end of the day, when you are subjected to medication, you are able to buy time. But are you able to eradicate the disease? No. It's always for time being that you get relief, but you are not able to get rid of the same. I have been doing my research for good 8 to 18 hours a day for last 33 years. I have been working with my own concepts and coming to a conclusion or coming to an answer how we can get complete cure. In the meanwhile, my mind took me to an answer, and that is that everything is pre-programmed. When we are born with pre-program. The 46 chromosomes that we carry, each chromosome carries a portfolio for 20 to 200 disorders. So when we take medication or when we take a local treatment, we do get relief, but it's temporary. Sooner or later, on an average 3 to 6 months down the lane, your chromosomes, your programming again sets in the limits. So you will find that there is always a relapse. So this relapse is not what is due to the negligence of the doctors. They did their best. But because you are pre-programmed, the disorder reappears. So this was my challenge. I didn't want to work on the physical level. I did not believe that giving relief to the patient is important. For me, what was more important is a challenge that once the patient undergoes a therapy, he should be rid of the therapy for life. That was the challenge. So I got in touch with a company in America. I went there in America for my training. I did my research on their equipment, and we found out that even for a 1-day-old baby, we can do a computer analysis and we can find out what would be the challenges for this soul in this birth. Now, nobody would like a 1-day-old baby to be diagnosed or a 10-year-old baby to be diagnosed. So then who are the parents who would really take this call? Well, if there is a family history of some disorder, diabetes, cancer, asthma, arthritis, and they know that this is running in the family, they may want to take a call, right? Or then we say in teenage, once you are in your teenage, do take a call of a diagnosis. If not, maybe at the time of marriage, get married, but don't produce children till you don't take this diagnosis. Once we have diagnosed, we will be able to pinpoint that the couple who carries what genes. So if one of them is carrying diabetes or one of them is carrying cancer, asthma, arthritis, whatever it is, the same programming you're going to transfer to your children. And no parent would like to give this gift to their kids. So this is one of the right opportunities that you get, that before you go in for child, get a diagnosis done, analyze and get it corrected. Or finally, when people come to me for treatment, we tell them, don't disclose why you have come to me. I'm not interested to know the reason why you have come to me. I will run my test. We run this 5-minute program. It's a 5-minute test where 7,000 parameters are diagnosed. Once the diagnosis is done, we ask the patient to reveal to us why they have come to us. Now, whatever is written in their allopathy reports will be on my computer screen. See, all of us are having maybe 100 disorders. The two of you, me, myself, I may be having hundreds of problems. I'm having specs, my hair is gray, aging process is on. But that doesn't mean that we want to make everybody gods or immortal. No. The idea of my work is to take up the challenges that would disturb your lifestyle. So if there are certain issues that could disturb your lifestyle, that could bring in danger to your life, let's correct only those issues. So even when patients come to me, we don't disclose, we don't tell them you have XYZ, ABC problem, this problem, that problem. No, that's not my job. My job is you tell me what you want corrected, and whatever you want corrected, we will do it. So here what we do is, by knowing your challenges, we find out which chromosomes are in charge of it. Like for cancer, we found out that out of 46 chromosomes, 6 chromosomes are programmed to instigate cancer cells. So if these 6 chromosomes are corrected, cancer will never be in your medical charts. We have 17 chromosomes for diabetes. Now, why do you think diabetes is not controllable? Or people argue with me. No, it's okay. I mean, I'm taking insulin. I'm okay. I don't have diabetes. Boss, you're taking insulin. What if you don't take insulin? I know a lot of my friends, a lot of people, they will attend every wedding party and they'll carry an injection with them. Just before having the dinner, they will inject themselves and have a good dinner. So that's a challenge. So here, if these chromosomes are corrected, definitely the person will be rid of the disease known as diabetes. And if after that, after the correction, if he produces children, the hereditary sequence will be broken. There will not be any hereditary complaints from his family. So this was the main challenge that I was working on. And we found out that if we are able to tackle the genetic component, understand and tackle the genetic component, we are able to conquer the disease. The next challenge which we found was immune system, which again I give a challenge to all my patients. If you have asthma, diabetes, cancer, any disorder, even sneezing, okay, or eyesight, we are wearing glasses, whatever your challenge is, it is because of an autoimmune state of your body. Today, India is so powerful. China is trying to attack us. Pakistan is trying to attack us from one side, but they are not successful. Why? Our army is strong. The same way, immune system is our army, air force, navy, everything. If they are strong, nothing can disturb you. Nothing. But the day you get disturbed means that they are not doing their work properly. They have gone into an autoimmune mode. So this was another research of mine. The first one was genetic. The second research was the immune state of a body. Now, these are not covered in allopathy science. Okay, they don't cover these subjects. So what we found out was that the day you have a challenge, it's your immune system that's gone in the reverse direction, known as autoimmune. Once we bring back your immune system back to normal, again, things will be normal in your life. My third research was supplements. Now here, the two of you, maybe both of you love different food. I love a different food. Every human being has got a different taste. We like, somebody likes sambar, somebody likes dosa, somebody likes paranthas. Everybody has a different taste. The same way, every organ, every disease has got a different taste for supplements. So this was another research which I carried out, whereby I found out which organ or which disease is getting upset due to what type of supplement, whether it is amino acids, vitamins, minerals, or hormones. Okay, so this was very important, that if these corrections are made in the body, again, disease will be something not heard of. There would be nothing known as a disease. Here again, on further research, we found out that everybody needs a companion. Nobody likes to live without a companion. You find a couple of boys, they'll be doing mischief. You find girls alone, they will be doing mischief. But if you find a boy and a girl alone, they will be busy among themselves. They won't be disturbing anyone. So this was another thing, that every supplement requires a partner. So this was another research of mine, whereby we found out that usually we say, oh, you need white calcium, you need vitamin D, you need CoQ10. No, it's not like that. What you have to understand is the combinations. Like in homeopathy, they say ferrium phos and cuprum met. Okay, so like if your hemoglobin is low, you need iron. But to support iron, if copper is not there in your blood in the right quantities, iron is not going to increase your hemoglobin. So it's ferrium phos and cuprum met, iron and copper. The same for your bones. You have calcium and vitamin D. For B12 and cobalt. So basically what we found out, that every supplement needs a partner. If the partner is missing, or if the partner is not healthy, the supplement that you are taking will be of no use. So this was another thing that helped us in giving the right result to our patients. And like I said, unfortunately for me, people don't come to me at the first stage. I get my patients only as recommendations from hospitals, doctors sending the patients to me. And unfortunately, all these patients are metastatic. That means fourth stage cancer. That is when doctors have closed the file. When doctors have said you cannot survive for more than a month or 2 months, that is the time when patients come to me. So I have been handling all terminal cases, whether it's bypass, diabetes, cancer. But yes, I give preference to cancer patients.
Honestly, this is true that doctors are meant to save lives, sir. Honestly, sir, we just talked about the first area of research. So emphasizing on that particular part, you said that I'm really intrigued by how you define that there's a lot of difference between temporary relief and permanent cure, right? So you just gave an example. If I have to plan a baby after 3-4 years, so I have to come for my diagnosis today, right? So how do you spread that kind of awareness among people like us?
Well, in my last 33 years, I have never done any advertising.
Okay.
I have not done any promotion.
Mm-hmm.
I don't do. Like I said earlier, I had lots of money. If I wanted money, I was an international businessman. Money was not my criteria. I'm doing this as a passion. I'm doing this because I love to do it. I love to save lives. So I'm not a person who would like to do marketing, who would like to talk about it. And the other reason is that, you see, there are these big fish in the market who may not like it. If you know how Baba Ramdev was tortured or was treated by a section of medical people, right? So they are very clear that they do not want anybody who can heal people, who can treat people, who can get a remedy for the people. So there are these class of people who say that as long as my bakra is alive, I will make money. So you see, I do not want to get into that hassle of advertising and promoting myself, because I spend most of my time in my own research, and well, I have known and unknown doctors who have read about me and who do keep on recommending such cases to me. So I'm okay with it. And once I take up a case, I need 3 to 6 months with my patient. So you see, it's not that, and we don't have any walk-in system. I take only 4 cases a day. That's it. Fixed timing, pre-appointment. And because when I work for 2 hours, I'll be working after they've gone on them, 45 minutes along with them. So it takes all my time. I have to do a lot of research. I have to do a lot of thinking. I have to do a lot of programming on from which angle we need to treat them. Another thing that you need to understand out here is that when you go for your normal treatments, you go to rectify one disorder and you get 4 bonus shares. If you understand what I'm trying to say. थोड़े दिनों के बाद ये प्रॉब्लम भी शुरू हो गई, वो प्रॉब्लम भी शुरू हो गई, or this also has started, and then you say, oh, you know, first that person went through this, then this, then it's not that. It's because of the treatment. It's because of the medication that other things have been disturbed in your system. But here, when we work on your chromosomes, we work on all 46 chromosomes. So when we are tackling one issue in your system, along with that, maybe 4 other issues are also getting corrected permanently. So there are no side effects. We work with frequency, which is a natural frequency, no drugs, no chemicals, no injections, no surgery. And that is why it is known as non-invasive. So our work is non-invasive, whereby only with the help of frequencies, we try to understand your frequencies, which are the faulty frequencies, and correct the frequencies to the right functioning so that your system gets back to normal.
Okay. So, sir, now we would like to know any area of research that you are working currently?
No, currently I am still working on the same fields. That my recent research was supplements. So at the moment, like it started with genetic, then it came on to autoimmune, and then supplements. So now the last thing that I'm working about is the combinations. So which combinations are required or should be administered for correction of what disorder? Because what we found out that usually people say that hemoglobin kam hai to iron le lo, but you will find a lot of these ladies, they feel that kuch nahi ho raha hai, or within a month or 2 months iron wapas hemoglobin again drops down. So this is what it is, that you need copper with it, or vitamin D. I was recommending to my patients 30 years back, but allopathy science came up with that idea recently. It was only recently that they came up that calcium with vitamin D has to be administered. Otherwise, it was only calcium all the while. Correct? Now again here, what we are doing is we are adding With calcium, we are adding D2, which is a hormone to make things work better. What allopath or what the medical science is doing, they are giving you D3, which is a biochem. We are giving you biochem plus we are giving you a hormone D2 to strengthen your case better. So these are some researches that are still going on where we are trying to find out that if supplements have to be administered, then in what combinations they will do wonders and they will have a perfect result on the client.
Okay. All the best on this research, sir. So, sir, before we end this interview, any message that you have for our viewers?
Yes, I would like to say that don't take your life lightly because we all go through challenges. It is always advisable to get a diagnosis done at the right time. Please understand that if a disease or disorder reflects on your physical, then it is a permanent disorder and it will take a lot of time to be worked on. But if we are able to analyze a disorder that has yet not taken a form or which has yet not manifested on the physical body, it will be easier for us to dislocate it. It will be easier for us to remove it totally. It's like एक बार आपने घर बना दिया तो फिर उसको तोड़ना मुश्किल हो जाता है. But the moment you find somebody is looking out for a place and is trying to get the building material there, you stop him right there and you have saved your piece of land. So understand the challenges, understand the problems. Do not let the challenge be reflected on the physical, and this is the mistake that we all make. If we have challenges in our life, we will first work on it on our own, then we'll go to a doctor and take some medication, and then we will just try to while our time. But when it becomes too high for us to live with it, then we look out for the right options. So don't wait till then. At the onset itself, look out for a solution, or if one can maybe take timely diagnosis, what we are offering, we would be able to predict to them that these are the challenges you could face in this life. So that is very important.
Right. Thank you so much, sir, for your advice, sir. And I must say that all your areas of research, be it genetics, be it autoimmune, be it combinations, they are contributing a lot to the healthcare world, sir. And I must say, we must say that being a doctor, we should say thank you to you for saving thousands of lives, sirs. And we wish you all the very best for saving many more lives in the future, sir. Thank you so much, sir. Thank you so much, sir, for your time.
Thank you. I can just add one more thing here.
Yes,
I was
sure.
awarded as the best cancer specialist in Asia for
That's
this
great.
type of therapy. That is without chemotherapy, without radiation, without surgery. Naturally healing cancer. So in Asia, I'm supposed to be the best. So let's hope people make use of this therapy.
Right. That's great, sir. Thank you so much, sir, for taking out time for this interview. Thank you, sir.